Hi guys, today I actually woke up with some pain around the right side of my shoulder blade, between the shoulder blade and my spine. And the pain went all the way up to the bottom of my neck and down to the bottom of my shoulder blade. I felt it immediately when I woke up from bed with the back of my head resting on my pillow. Now normally you shouldn't try to diagnose yourself, you should seek treatment because some of these things can actually be a bit advanced. However, I have 4 years education of anatomy and manual therapy and about 8 years of experience practicing the trade. So I actually think I qualify on treating myself. So in this video you basically get to follow me in my thought process and how I am diagnosing and trying to self-treat this problem. Now I actually have a lot of experience with specifically this kind of problem, and I know that you don't have to be an expert in order to understand what I'm going to showcase to you. You could actually be an amateur in the subject and you will still probably get something out of this video. So first thing first, I wake up and have acute pain and I don't know the cause of it. The first thing that I do is I grab this wheat pillow or heat pillow and I put it into my microwave, heating it up for about 4 minutes. Then I put it on my shoulders like this, where half of it is going to one side like this. So I'm balancing it, so one part is heating my back and one part is heating the front, and the front isn't really interesting, but it's the back I want to affect. The heat is going to open the blood flow and increase circulation, giving more air and more oxygen and more blood to the muscles, and this will decrease pain universally regardless of what is causing the pain. It's a great start to help me through the day. Normally I have it inside my bigger shirt, where the shirt is locking the wheat pillow onto my skin, so it's heat to skin directly and isolating the complete thing. And you look like something of Quasimodo, but trust me, you are going to do this yourself as you realize you're going to get rid of your pain this way. After this, I'm going to work on the bike. I always drive to work on a bike, and as I'm riding my bike, holding my hands on the wheel, moving my head all the time, I constantly feel a pain that is annoying, nagging and molding right between my shoulder blades. The pain is also there during treatment when I am actually treating patients with their pain. I constantly feel it, and there's a small touch of it as I'm working with my hands and moving my head around. Eventually I can finally have some time on my own where I can do some diagnosis on myself. The first thing that I do is that I lay down on my own treatment bench. I elevate the headrest so that my head is going forward, just like I was lying down on my pillow. And this really hurts. Then I do a different thing. I lower the headrest where my head is just going straight back, as you can see in the picture. And the pain is instantly gone. I don't feel a thing. Now we've learned a lot. The origin of my pain has something to do with the positioning of my head. So we experiment a little bit more. I lower the headrest and I lay down on my belly where my head is going forward, just like it would be an elevated, and I put my head on the side and I test both sides. On the other side I don't have that much pain, but when I have my head towards the same side that's the pain is on, remember, I had pain on my right side on my shoulder blade, and when I move my head towards the right side and also move my head forward, I get an extremely high amount of pain. This was the position that hurt the most. So is it muscle or is it joint? There are a bunch of different muscles that could actually cause this kind of problem. For example, trapezius. If trapezius is contracted really tight and I'm trying to stretch it out by doing that head movement, that could actually cause some pain. So how do I actually know if it's trapezius or not? Now there is a cool trick here. As you can see, trapezius are actually connecting to the shoulder blades. So if I put my elbows down on the structure here, the table, and I move my head to different sides like this, if I still feel pain, I know that it's not from trapezius because I'm relaxing. I'm not stretching the muscle trapezius like this. If I would pull my shoulder blades down and do this, this is stretching trapezius. But as I'm elevating my shoulder blades, I'm not stretching trapezius. And this still hurts. If this wouldn't cause any pain whatsoever, and this would cause pain, the problem of my problem would come from this muscle, but it doesn't. There is also this candidate, rhomboideus, another muscle within the shoulder blade area, within the area of my pain origin. However, this muscle doesn't connect up in the neck, it is only down in the thoracic region. And I had more pain when I rotated my head. And if I wouldn't have any change in pain as I'm rotating my head, this muscle could have been suspicious. But as I'm having pain as I'm rotating my head, I don't think this muscle is affected at all. That actually takes us to another muscle that few people actually know about, splenius cervicis. And this one is really deep. It's like down to the actual bones, beneath all other muscles. So it starts from the pain of my origin and it goes up to the neck and it actually rotates my neck. So this could definitely be something of a muscle that is causing the problems. However, it's not actually the villain at all, because I have problem when I'm rotating my neck towards the same side. And if this muscle would have caused the problem, I should have pain when I'm rotating my head to the left, and I should feel pain on the right. And it's the opposite. So I don't think this is the muscle either that I'm having a trouble with. I hope I haven't confused you with a lot of strange muscle talk in Latin. What I've actually learned so far is that there is no muscle whatsoever that is actually spot on causing my pain. Therefore, it is probably the joint. The next thing that I do now that I suspect that I am having a locking, something in my thoracic region that is causing pain in the joints, I go out to my gym at my work and I start working out, trying to exercise all of the shoulder elevating muscles to give them some circulation and stimulation. When you're working your muscle like this, you're increasing your blood flow, and that is going to make your muscle relax, giving them oxygen and nutrition. After a short workout, I go back to the original position and I lay down on my treatment bench. I lower the head raise and I let my head go down and I rotate it to the same side as my pain is, and I do feel pain again. Then I stay in this position and I rest. Yes, I actually lay here and I do feel a constant pain, but I know after some analysis that is probably coming from the joint, and as I stay in this position, even lowering the head raise even more, trying to really stretch out and increase my mobility, eventually the pain is slowly decreasing. Now there are of course quicker methods. For example, there is a manipulation therapy where I could simply just go and ask, hey buddy, colleague of you, could you just come here and just on my back? And my colleague would be simply just walk through the room and help me out. However, it's Corona time and my colleague isn't actually at work, so I have to do something on my own, and it's really hard to actually do manual manipulation therapy on your own, so this is what I'm stuck with. But that is also making a perfect case, because if you're on your own and you're sitting home and you're trying to solve your own problem that is the same problem as me, this is something you could actually do on your own. After about, I think it was like 7 minutes, give and take, the pain was actually 100% gone. And this was actually the position where I felt the pain most. It really hurt in this position. But after just 7 minutes, I was cured, so to say. But as I have experience in this, I know it's not over. The next thing I did, and don't freak out or be scared, is that I completely removed the entire head raise and I started doing this, exercising with my neck, moving it from side to side and up and down, trying to give a workout on my muscle and really try to get some mobility into my thoracic joints. Then I took a break from that, I went back out into the gym and I started to rotate my shoulders to give more mobility in my shoulder blades with some weights on. I also did this. I took a tiny little bowl that I placed onto my muscle between the spinal cord and my shoulder blade, and I tried to really give my muscle a real taste of pressure. And I kept on doing these self-treatments for about 30 minutes. After all of that, I don't really feel any more pain whatsoever. I can move my head right down and rotate it like that, and no pain at all. Sometimes I feel a tiny bit of pain in like a 1 millisecond, and then it's just gone. And I think that is going to disappear if I just keep on being active and just make sure that I take care of the body and just keep on using the body and moving it around. This video was thought of, filmed, recorded and edited all on the same day. I woke up about 7 o'clock. I had instant pain. The pain was basically gone around lunchtime, 12 o'clock. And now as I'm sitting here, I don't feel any pain at all. So this was basically a behind the scene of how a therapist actually thinks and work, and how a therapist basically self-help and try to get rid of his own pain. I hope it actually brought you something, and that this was something of educational for your own kind of problems. But as this is a one-case scenario, it's very hard to actually take this into your own application. I do recommend asking and seeking help to a real therapist if you feel uncertain. This could potentially help you thinking like this, doing the exercises that I did, if you have the exact same pain that I have, but I don't guarantee that it will, because you could have a completely different problem than the one that I had. But I could definitely read your own situation. If you have any questions, feel free to drop a comment below in the video and I will try and answer that question.